Hi.
I'm Allison Lynch. I am a nurse practitioner student. I'm working with Dr. McKinley. So I just want to come in and I'm going to do your little overview, talk to you a little bit, just like why we're here today.
Okay.
And then I'll do your assessment and then I'll take everything back to Dr. McKinley and we'll go over it and go from there, okay?
Okay.
Do you go by Kimberly?
You can call me Kimberly.
Okay, good. I'm just going to be looking at this a little bit, taking notes, looking at your assessment that you filled out before you came in today. I see you're already an established patient with Dr. McKinley, but since I'm getting to know you, I might ask you a couple extra questions that you might already have talked with her about, okay? So tell me why you came to see me today.
Well, I came for like my yearly physical, blood work, things like that. Yeah, that's why I came, but I kind of wanted to talk to you about maybe some anxiety issues that I've been having, maybe.
No, that's fine. That's totally fine. And we'll totally go a little deeper in with that. Is there any other concerns you've been having that we need to discuss today?
No, I don't think so.
Okay, well, let's dig a little deeper into this anxiety problem you've been having. Tell me a little bit more about it.
I don't know. I just feel like I've been getting a little bit more overwhelmed, kind of snapping a little bit. When I get home, I feel like kind of nervous about things. Just, I don't know, kind of
how
overwhelming.
long has this been going on?
Probably about 6 months.
Okay. Have you ever had issues with anxiety in the past?
I have. It's probably been about 3 years since I had my daughter that I have not been taking any medication. And then just the last 6 months, I keep telling myself, like, go to the doctor, no, you're okay, kind of trying to talk myself out of it.
Okay.
Yeah.
I get that. Is there anything that's been going on in the last 6 months that kind of maybe triggered this anxiety? Or, because I know you said it's been about 3 years since your daughter was born, but the last 6 months it's been getting worse. Anything that maybe triggered that?
I mean, my daughter turned 16. That's kind of stressful.
Yeah.
She started driving. That may have been kind of what's made me, get worked up about things and just stress about, just have crazy thoughts.
Well, they're also getting older, and high school is a crazy age, so that's understandable as well. Have you had any panic attacks associated with them, or has it just been kind of a generalized anxiety?
I've had a couple. I guess you would call them anxiety or panic attacks, yeah. Okay,
what happens when you're having these?
I just kind of feel super overwhelmed. My heart starts racing, sometimes I get palpitations, and then that freaks me out even more because then I think I'm dying, and yeah.
Any other symptoms such as breathing issues or?
No, I don't think any breathing issues.
Have you been able to calm yourself down whenever you have these episodes?
Sometimes I can. I try to, I'll do some deep breathing exercises, try to pray. If I'm at work, I'll kind of go in the bathroom and just kind of talk to myself. I know that sounds crazy, and try to just calm myself down.
Okay, no, that's totally understandable. You gotta do what you gotta do sometimes. Let me see. How severe would you rate then your anxiety on a 1 to 10 scale, would you say?
It's definitely getting worse. It can get pretty high, maybe like an 8 or a 9.
Okay, all right. Have you noticed any patterns of anything that triggered it?
Not really.
Okay. Is it affecting your sleep at all?
Not really. I guess a little bit. I fall asleep really well, really quickly, actually, thank God. But then I wake up. If I wake up to go to the bathroom or something like that, then I can't go back to sleep because sometimes I just can't shake some of the thoughts that are going through my head,
Okay, all right. Is there anything that's been able to relieve it? Have you tried anything already to help relieve the anxiety?
Not really, just,
Okay, and you said there's nothing that you're doing in particular when these come on?
No,
it's just throughout the day.
Just really random.
Okay, all right. I'm going to dig a little deeper into your family history and some of the other things going on in your life just to get to know you a little better, okay?
Okay.
I see here that your family history. Oh, you little girl, hi.
Yeah, sorry, I had to bring her with me today.
That's fine. I see that you do have some family history of diabetes and stuff like that, heart disease. Any history of anxiety issues, though?
In my family? I'm sorry.
Yeah.
Okay. I don't really, maybe my mom.
Okay.
Maybe my mom, but I don't think it's ever been anything that she's gone to the doctor for or anything. I think she just, my mom.
I get that. What about your children?
No, I don't think so.
Siblings?
I don't think so.
Okay. What, any siblings that you have issues? I think you said your mom.
Well, you know, my brother, he's got some mental issues. He, you know, some drug abuse. But again, nothing that he's ever gone to the doctor for, you know.
Okay. All right. What about your parents?
Just my mom. Yeah.
Okay. And grandparents?
I don't really know. They passed away when I was young.
Okay, that's fine. That's fine. Tell me a little bit about your living situation.
Well, I live in Warner Robins, and I have my 3-year-old and a 16-year-old, and my husband and 2 dogs, and yeah, we live in a cute little neighborhood.
Okay, all right. Do you work?
I do. I'm a nurse. I work in Macon.
Okay, good. Would you say you have a good support system?
Yeah, my husband works a lot. He's a nurse too, so he works like 6, 12-hour shifts a week. But my mom helps me a lot.
Okay, good. She's
Sorry.
cute. No, she's cute. It's fine. So talking about your husband, I know you said he's a good support system, but he works a lot.
Yeah.
Do you think that has anything to do with your anxiety?
I mean, it could, you know, I mean, I do a lot. I got a lot going on,
Okay.
you know.
All right, I understand. Would you say that y'all are having any issues with your marital life because of the anxiety?
No, I don't think so.
Okay, all right. What about your sex life? Any issues or concerns there?
No, I think it's okay.
All right.
You
And
know,
y'all are exclusive?
balancing it with work and kids and all that stuff.
Oh, yes,
Yeah.
I understand. And are y'all exclusive?
Yes.
Okay. All right. Sorry, girl. I see you did check that you do use alcohol. How often would you say?
Maybe a couple times a week.
Okay. And what is it that you drink?
Beer.
Okay.
I like to drink beer.
Okay. Any tobacco use?
No.
Any drug use?
No.
Street drugs, illicit drugs? Okay. I see no known drug allergies. Is that correct?
No drug allergies.
All
No
right.
food allergies that I know of.
All right.
Yeah.
Good. And medications, look like you're on a multivitamin and a baby aspirin. Anything else you're taking?
I take a baby aspirin. I take vitamin D.
Okay.
And that is it.
Okay. No birth control? Or
No.
Okay. Any history of any surgeries?
I've had 2 C-sections.
Okay.
But
Any
that's it.
injuries?
No.
Okay.
No.
I'm looking here. It looks like you've had all of your screening tests and immunizations. They look up to date. Do you have any questions about those?
No, we stay pretty up to date with that.
Okay, good. I know you said you're a nurse.
Uh-huh.
Any issues with your work life going on that could be associated with your anxiety issues?
I don't think so. I mean, it's a job, but I like my job. I'm happy with my job.
Okay, good. And any hazards you would say? Besides, of course, always backs for one of the first things we think about. But any other issues?
I don't think so.
Okay, all right. So what do you do to try to relax? Just on a daily basis, even when you're not having your issues with anxiety, what do you try?
Gosh, I feel like I don't get to relax very much. I mean, if I can get my child to go to sleep, I like to, binge watch the ID channel.
What's the ID channel?
Investigation Discovery. Murder.
Oh, okay.
It's the murder channel.
Well, that might not be helping with your anxiety.
Yeah, probably not. That's probably why I'm more paranoid.
Well, but I guess that can be your guilty pleasure. That might not be helping.
Right.
But what about exercise? Do you exercise at all?
I just started exercising. This is going to be my 4th week that we're starting. So my husband and I take turns running in the morning.
Okay, good.
So I'm averaging about 2 to 3 days a week.
Oh, well, that's
Yeah,
awesome.
so I'm trying.
Good.
It helps
Okay.
a lot. I know that when I exercise, it kind of helps with my anxiety and I feel better.
Okay, good. Exercise can definitely be a stress reliever, and it would have been one of the things I recommended. So I'm glad to see you're already started trying that. I know we talked about your sleep and how it's affected, a little with anxiety. Were you having any sleeping issues before the anxiety kind of started creeping back on? Okay, all right. And what about your diet?
I eat a pretty healthy diet. I'm a food prepper and prep my meals, and they're pretty healthy.
Okay,
I mean, of course, we all cheat and love to, but yeah.
About how much caffeine do you take a day?
Maybe 1 or 2 cups of coffee.
Okay.
In the morning. Gotta have my coffee.
Okay. And what about any dietary supplements?
No.
Okay. Another little curveball question. What would you say? Are you a safe person, a cautious person? Do you wear your seatbelt, bike helmets, that kind of thing?
Yeah, I think I'm probably safe and a little overly cautious and nervous about life, so.
Which might tie in a little bit with the anxiety.
Right,
so understandable.
right.
But we do, you know, we want you to be a little safe and cautious at
Yeah,
times.
yeah.
So, well, it's been great talking to you. I'm going to take this back to Dr. McKinley, talk it over with her, and we're going to make a game plan for you, okay?
Okay.
And I'll come back.
All right.
It was nice to meet you,
Nice to meet
Kimberly.
you.
I'll be back
Okay,
soon.
thanks.
Thank you.